Hello everyone, welcome to the lung page. Today we are going to see about subcutaneous emphysema or surgical emphysema. So we'll start with the history. 30-year-old lady presented with sudden onset of neck swelling following a dental procedure 3 days back. So this is the history. So this is a image how this lady presents. So presented with this side swelling, right? So we took a chest x-ray. Chest x-rays look like that. So we all know how to read the chest x-ray with the ABCD order. So we all know, right? We see airway okay, bones everything is normal. See cardiac contour is normal, but you can see here a little bit lucency is there and diaphragm normal and lung field everything's normal. Here is little bit white patch is there. Okay, so when you see this neck area, so you can see very clearly here little bit uh, lucency is there, straight lucency is there with and cardiac contour also. Here you can see this lucency is there. So what is this called? So this is called pneumomediastinum with subcutaneous emphysema. So this is a chest X-ray diagnosis, right? So this is called chest X-ray diagnosis as subcutaneous emphysema plus pneumomediastinum. So we all see what are the causes of subcutaneous emphysema, how we can manage. We'll see one by one. So subcutaneous emphysema, what is it? Subcutaneous emphysema is the presence of air in the subcutaneous tissue, usually over the chest wall, neck and face. So subcutaneous emphysema is a clinical science. It is not a disease. Okay, you have to clearly understand regarding this. So why it is occur? Because air leak from the lung or airways or GI tract from the along to the tissue planes to the skin, right? So common causes mainly chest related. If the patient have a pneumothorax, chest trauma or barotrauma or bronchial injury, sometimes bronchial carcinoma malignancy cause bronchopleural fistulas, or sometimes the patient the chest tube insertion, thoracotomy, tracheostomy. Sometimes the patient during the intubation also patient develop subcutaneous emphysema. So other causes mainly esophageal rupture, ENT or dental procedures, or sometimes very rarely gas forming necrotizing infections can also lead to this type of subcutaneous emphysema. So we all know during the intubation procedure, patients sometimes develop uh, facial swelling. So this is called subcutaneous emphysema. So how can we diagnose? So clinical features mainly painless swelling of the face or chest associated with crepitus on the palpation. That is a important finding. Crepitus on the palpation. Sometimes patient present with voice changes or periorbital swelling. So red flag signs are mainly airway compromise, visual impairment or dysphagia because of the massive air leak. So during that instance, we have to work then and there to reduce the symptoms. Diagnosis mainly clinically. We can check the chest X-ray or CT chest to identify the air in this tissue plane. So in the subcutaneous emphysema, how can we classify? How can we grade that one? So grade 1, 2, 3, 4, 5. According to that, according to the involvement of the subcutaneous emphysema, right? So grade 1 is mainly in the below the neck area and also extend to the neck, face, and also with that chest wall. So with that we get classified into grade 1 to grade 5. So how can you manage this one? Management mainly treat the underlying cause. If it is patient with the chest tube insertion is there, we have to put chest tube insertion because of this pneumothorax. Or sometimes the patient have persistent air leak through this uh, chest tube, IC tube. We have to secure and we have to identify where is the leak and we will manage then and there. So we have to treat the underlying cause. Then how can you manage the subcutaneous emphysema? Mainly supportive care. We can give the high flow oxygen, analgesia, and observation only. So if sometimes the patient develop tension subcutaneous pneumothorax or sometimes the patient develop compartment syndrome, we have to go with the surgical incision and bore to the surgical incision to this particular subcutaneous layer to suck out the Yeah, and also we can put the subcutaneous drainage. So this is how we can manage subcutaneous emphysema. I think now you people are very clear about the subcutaneous emphysema management. Stay tuned. We'll see the very another interesting topics in future. Bye.